more about in your day-to-day as an OBGYN and now a fertility fellow. And as a fertility fellow, really, you guys are in the trenches. You are the ones who are essentially the backbones of an academic fertility practice. I certainly remember my days as a fellow, and it's fun, but it's also a time when you're looking at all the research, all the data, all the studies. What's that like for you in the time of COVID-19 as a fellow OBGYN, REI fellow, and looking at COVID-19? What stands out to you in that realm?
No, that's a great question. I think you said you're burning the candle at all ends, and that's kind of how it feels like. It feels like we've been sprinting since March. And as a fertility fellow, as a OBGYN, as a father, as a friend to a lot of people who are pregnant, thinking about being pregnant, it's a very stressful time. We like to be that person that people come to for advice. We like to be that friend that people can text when they're scared, when they're stressed. And we like to be that source of information that can make you calm, that can get you through the night. And in the time of COVID, it's been harder. It's been harder to answer questions about what's going on with pregnancy. It's been harder to reassure people that everything's going to be okay. I think at an academic center, thinking about myself and my colleagues, we've been at the forefront. We've been the referral center for Northern California, and we've had some COVID cases, not as many as the East Coast, but we've been dealing with the pandemic head on. And on a personal perspective, I've been trying to consume as much information as I can, stay up to date, and everything changes every day. But really just try to be that source of information and relate that to my patients, my family, my friends, and try to keep everybody as informed and as calm as we can through this difficult time.
Yeah, and what's that like for you, especially given that you said you're from Venezuela by way of Miami, but now you're all the way across country in San Francisco? How are you, or are you like me, which is I'm here keeping track of what's happening in the United States, but I'm looking at the East Coast where, in my case, there's a huge Southern Caribbean population, but I'm also looking at the Caribbean and looking to see what's happening, how are they managing? Is it the same for you?
Yeah, I think Venezuela is a little bit difficult because the access to information is not really there. It's hard to figure out what's happening. Reporting isn't great. I'm certainly looking at the East Coast, talking to my friends who are in the front lines of the New York hospitals and getting a sense of what's happening there. We're talking to my family in Florida, making sure that they're okay, getting a sense of what's happening. And I think that there's so much information out there. Some of it is great, some of it is terrible. And it's hard for a physician with 15 years of training to sift through what is real and what is not. Imagine what it's like for a regular person trying to figure out, what to believe and what not to believe. So I think that in our role as physicians, especially like you and me who are invested in social media, is to try to separate what's real and what's not real and help our patients and our followers make informed decisions that are based on data and not on hearsay.
Yes.